All right. Well, I think this is a good time for us to start today with our forum. Welcome, everybody. My name is Montserrat Serra, and I work at DMAS. I started working for the Department of Medical Assistance Services back in 2019. And my role here is to ensure that Virginia Medicaid complies with civil rights laws by providing language and disability access services to Virginia Medicaid members and applicants. We are here today with a presentation for everyone. This is open to the public. And we have invited our stakeholders. And today we will be discussing breaking barriers, how language and disability access training can improve access for people with limited English proficiency and people with disabilities. I'd like to give a big thank you to our DMAS civil rights team. We have John Stanwicks, my supervisor, and Jesus Perez, the civil rights compliance specialist. Both of them had put a lot of work and support for the forum, and I wanted to give them and recognize their work today here. Without them, this could not have been possible. I'd like to provide you all with some background on why we have been doing these type of webinars, what we call the forum. Some of you may know that this is our second forum of the year. We had our first one back in May, and our unit came up with the idea of having a language and disability access forum back in 2021. That's when we completed our agency's language and disability access plan. And back then we'd found and we documented that the agency had a need to engage and collaborate with our stakeholders to receive feedback that would help the agency stay up to date on the language and disability access needs of our community, but most importantly, that would ensure our members can effectively access our programs and services. It is important for us to highlight that the forum is for informational purposes only and should not be considered as legal advice. And I wanted to share that the details of our forum are always available in our DMAS website, and that is where you can get and receive the latest updates of our events. You will be also able to access the recording of this webinar, as well as other previous recordings and any materials that we will be sharing. They will be also uploaded later on that website. But before we begin, I wanted to share some of the logistics very quickly. I wanted to let you know that this is being recorded. And as I said before, we will upload that recording later on. I also wanted to let you know that we have 2 American Sign Language interpreters. They will help us interpret the event for those that need American Sign Language interpretation. Thank you very much, Elaine, and I can recall the name of the other person, but both of them, they will be taking turns to interpret. We also have cart services available. My colleague Jesus has pasted a link to access the live transcriptions of the event, and these are being provided by Virginia Relay, and Leora Grassi is our transcriber. If you wish to follow the webinar through the live transcripts, please click on the link and you will have access to those. Lastly, very quickly, we have the feature of the chat. And if you have any questions that you would like us to address, feel free to submit them through the chat. I have my colleague Jesus collecting all the questions. We will address those as time allows. some of those questions. If we don't have enough time, we will address them at a later time and then share our responses. But feel free to use that feature of the chat for any questions or comments you may come up. Please know that we will address the questions at the very end of the presentation. All right, so now we are here at our agenda. And first of all, we're gonna have the opening keynote, and we have Patricia Michelson-King. She will be providing us a 5-minute speech, and then after her opening keynote, we will move to the presentation. We will be sharing some very good information and good tips on that will help you implement a civil rights training for your agency. And then we will have in the middle of our event, the panel discussion. We have 4 agencies here today that will be sharing some very good information about how they have implemented or what are their goals on implementing training, a civil rights training for their organization. As I said, at the end of the event, we will have some Q&A, and then we will have the closing remarks. So with any further ado, let me pass it on to Patricia Michelson-King. She is a federally certified interpreter. She is a translator and consultant, trainer, and also VCU faculty. Patricia, the floor is yours.
Thank you very much. Well, good morning, everybody. For the sign language, everybody, no matter their abilities, their disabilities, their color, their income, should have equal access to medical care in this country. Sometimes people have the attitude of, well, why don't they speak English? Well, English is the #1 language in the world, and it's not in danger of losing that place, so don't worry. By law, the patient has the right to have an interpreter and have access to that information, the same as an English speaker. And any agency that receives federal funds and provides services must use interpreters or get sanctions and even lose funds. My message to you is that you need a trained interpreter. Imagine if you were the patient, and just because you have 2 hands doesn't mean that you're a concert pianist. Just because you have 2 languages doesn't make you a trained interpreter. For equal access to medical services, if you don't speak English, it means that you must have a competent interpreter because accuracy is important. I went to a Richmond hospital with my grandmother a few years ago, and in the emergency room, there was a sign that said, "For emergencies and women in labor only." In Spanish, it said, "Only for emergencies and working women." Imagine a woman who's 9 months pregnant coming in and pain and saying to herself, "Oh no, I can't sit down because I'm not working. No estoy trabajando." Okay? So not every bilingual person can act as an interpreter. So no family members or bystanders should be used. They may break confidentiality. They haven't been trained. They may not speak English or know the terminology. We don't know their level, and they may speak on behalf of the patient and think that's all right. So when a language barrier exists, the presence of a professional interpreter is crucial. And I hope you leave today understanding how crucial accurate interpretation is. And I want to leave you today with the assurance also that you don't have to worry if you're using a certified interpreter. And when an interpreter is not used, more money is spent, time is wasted on longer appointments, more diagnostic tests, number of visits, and trust is lost. Now, even when a patient can speak some English, language can slip with illness or distress. A patient's distress leads to a linguistic breakdown, and the minutes lost getting an interpreter saves time later. There's less money lost in lawsuits and hospital sanctions. And there can be dire consequences. There's the $71 million word story. Willie Rodriguez was an 18-year-old who was taken to a hospital in Florida, and his mother thought that he was sick because of a hamburger that he had eaten. And he kept saying, "Está intoxicado." Well, a bilingual employee said he was intoxicated, thinking that it meant the same thing. But in Spanish, intoxicado means food poisoning. So he was treated for an overdose of alcohol instead of an intracranial hemorrhage. And as a result of the wrong treatment, he became quadriplegic and the family sued. The judge declared that the mistake could have been avoided with quality translation services, and the hospital had to pay $71 million for this catastrophic mistake. But I don't want you to feel overwhelmed, because the purpose of today is to give you solutions as providers. One of them, use trained interpreters. We have to evaluate the interpreters that we call. In a study, institutions were asked who they called as interpreters, and the answers fell into two categories: the appearance model and the performance model. The performance model, people have taken a certification test, proven that they're minimally competent, put on a roster, and get called. That was less than 2%. The appearance model answers were, number one, they look bilingual. Well, that's racist. I mean, they look like Juan Valdez, must be the Spanish interpreter, right? Two, they were punctual. So it's comforting that you know you have a warm body present, but who knows if they know what they're doing. And number three answer was, well, no one has ever complained. But who is there to complain? No one else there speaks the two languages. So remember, not just anybody can interpret. Untrained interpreters may not know the medical terms, and for the patients, it's not the same care or interaction. By using a certified interpreter or qualified interpreter, you're giving more honor and respect. Some providers may think that they are able to adequately communicate. This is a true story of a doctor who'd say, well, they kind of understand me. He thought sopa sounded like soap. So he said, I'm going to pour some sopa caliente on your vagina. But sopa is not soap. It means soup in Spanish. So instead of warm soap, he was telling her he was pouring hot soup on her vagina. So the patient should be able to hear from a fluent speaker, and it's more respectful of the patient versus someone with so-so language skills. Because if their grammar is not perfect, it's harder and more painful for the patient to figure out what the health provider is saying, which is something that the English patient doesn't have to do. Bilingual providers are great to establish a friendly atmosphere and greeting in Spanish or for another foreign language, but the patient is embarrassed to say that they don't understand. And there are power dynamics in play, and the patient does not feel comfortable or want to stand up to the doctor or nurse. Another example, a doctor said to a mother that her son was retrasado, retarded, instead of that he had some delays or demoras in growth. The mother was suffering from depression, and she got worse. In the end, the doctor had a complaint filed against her, and it turned out to be a very big problem. So waiting 5 or 10 minutes for an interpreter is worth the time. And misinterpreting can have serious consequences. Interpreters should clarify and always write notes for important information like medication dosages and instructions, because obviously it's vital to the health of the patient to have the information interpreted correctly to avoid overdoses or underdoses. Lastly, Google, Babbel, etc. translation programs are not always accurate, and they've caused problems. An example was during COVID, the VHD's website in English said the vaccination was not required. In Spanish, it said it wasn't needed. 38% more of Latinos got COVID. Now, the SETI program, Spanish English Translation, Interpretation, and Translation Program at VCU is the only one in the state. And maybe some of you are interested in learning the mechanics or the cultural competency part of interpreting. SETI is not only for Spanish majors. We have students from all departments and walks of life. But for those of you who need interpreters or translators, at SETI, we can help you with free translations and interpretation. And please feel free to call us, and it will be reviewed by professionals, so you know you're getting quality service. So don't hesitate to contact me. Thank you.
Thank you so much, Patricia. This has been very helpful, hearing about your stories. It's very helpful, especially knowing that accurate translation is so important. For the audience, please note that we are sharing Patricia's information, contact details at the end in one of our slides. So if you would like to reach out to her, there's going to be an email and contact information that you can use at the end of the presentation. All right, so we're ready for the next session, which is our presentation. And today we will be discussing tips to help you implement a civil rights training. If you're thinking about implementing civil rights training at your agency, or you just want to learn how DMAS develops its civil rights training program, you have come to the right place. Before we delve into the content, let me provide you with some background on the DMAS civil rights training. The training was one of the strategic initiatives that we outlined in the agency's Language and Disability Access Plan that we published in 2021. The training, the civil rights training for DMAS, was launched in 2022, and it consisted of a self-paced 30-minute module and also a webinar presentation. During that year, over 500 employees at the Department of Medical Assistance Services completed the training, and since then, it has become a mandatory training for all new employees that come to work for our agency. Now for 2024, we are working on a training refresher to remind our employees of the organization's non-discrimination policies and procedures. And this will ensure that they understand the responsibility to enable LEP individuals and those with disabilities to access information and services in a meaningful way. At the presentation today, I will talk about the significance of incorporating civil rights training and the primary stages involved in its implementation. These stages include the planning of the training, the development, the implementation, and post-implementation phases. I will provide an overview of each of these phases, and we will be sharing some useful ideas and tips that we used at our agency and that have worked for us. All right, so why are civil rights training very important? I think Patricia has shared very good information that connects to the importance of the training today. But civil rights training is crucial for organizations as it ensures compliance with legal requirements and regulations related to equal access and non-discrimination. It also, as Patricia explained, reduces the risk of legal issues and liabilities. The training informs employees about the policies and procedures that the agency has on language and disability efforts so that they know what to do when they have a situation where they need to communicate effectively with someone who is limited English proficient, or perhaps someone who has a disability that impacts the way that they communicate with others. For instance, in a civil rights training, employees can learn how to request interpreting services or perhaps translation services if they need to translate a document. Civil rights training also promotes an inclusive culture where all individuals, regardless of their background, can access and benefit from programs and services. The training provides staff with the tools necessary to recognize and address discrimination, mitigating legal risk and liabilities of non-compliance with civil rights laws. By demonstrating our commitment to civil rights, agencies and organizations build public trust, reinforce their credibility with the public, and maintain a positive reputation, which ultimately benefits our clients and the community that we serve. All right, so let's start with the very first phase of implementing when you implement a civil rights training, and that is the planning phase. During the planning phase, that's where we lay the groundwork for a successful civil rights training program. This involves tailoring the training to our particular agency's unique needs, deciding on the training format, also assessing the resources that the agency has to implement that training. it is an important phase for us to set up a realistic timeline and involve our leadership from the very beginning. Tailoring the training is important for an organization, especially if some staff members interact with the public more than others. In such cases, perhaps it may be necessary to implement a general civil rights training program for everyone, and then provide additional training details to staff that are more in constant contact with the public. For example, at DMAS, we provide civil rights training to new employees, but we have also developed additional training that provides more hands-on experience on how to request language assistance and how to work with phone interpreting services. We feel that those are some of the most needed pieces for those that are more in constant contact with the public. And when choosing the training medium, it's important to consider what will be more effective. Perhaps the organization considers that a face-to-face will be more beneficial as part of a training, or perhaps a virtual training. It all depends on each agency. At DMAS, we decided to mix and match. So we provided a virtual section where every employee could use their own time logging into an online module and complete the training, but we also provided more like a face-to-face interaction. It was done digitally through a webinar. So it's important to decide which medium might work best for your team and your organization. And also establishing a realistic timeline is essential. We learned by experience that you set up milestones, but it's so important that you add plenty of time around those milestones, as there are always, and trust me, there will be always last minute circumstances that just come and surprise us and make us switch or milestones and timelines. So having a realistic timeline with enough cushion to make sure that you meet your deadline goal, it's very important. And it's also very important in the planning phase to think about providing an interactive training with activities that staff can engage while learning at the same time. We want to make sure it's not a boring training and it's more like an engaging training so people enjoy while also learn. For example, if you're delivering a virtual training, you could be using polls to ask participants to provide their input on a particular training topic that has been discussed. And that, for example, would not only ensure that participants are following the training, but also makes the training more enjoyable and fun. Lastly, I would recommend to involve your leadership teams from the very beginning when you are planning your training. This can be very helpful, as if you get their buy-in and support from the very beginning, the agency is already aware and understands the priority for all teams and divisions to complete. So they will be on your side if you get them involved from a very early stage. All right, so we have discussed the very first phase of planning the training. How about the development phase? Let's talk a little bit about some tips on that phase. And during that phase, it's very important to focus on creating a complete outline that covers all the necessary aspects for a successful civil rights training. This outline for a particular civil rights training should include the legal civil rights requirements for your particular agency and also the practical procedures for your own staff that they can follow. The description of effective visual engagement elements should also be included in this outline storyboard, as it can be helpful for your leadership team to approve at any given time that you're going through the development phase. It is important to consider including information on civil rights legal requirements and regulations, again, that are relevant to your organization. For example, The DMAS civil rights training includes information on more general non-discrimination laws, such as Title VI in the Americans with Disabilities Act. However, since DMAS works with Virginia Medicaid, our training contains information that applies to Section 1554 of the Affordable Care Act as it relates to non-discrimination laws within the healthcare setting, which is the Virginia Medicaid setting. So in order to make your training more visually engaging, you can include elements, for example, that we have done as images, or perhaps including silhouettes or charts or smart art, or any other graphical representations. That makes the training more engaging. And for example, if you use PowerPoint to deliver your training, you can easily insert these elements and it will make it more interesting and engaging. At DMAS, we have chosen to provide and include silhouettes of people, and that is as an image representation of someone providing the training. It feels that these silhouettes of these images of a person in a different pose next to the content, it kind of like provides more a professional look and interesting look, and it also provides a face of who the trainer will be in when delivering that training. So those are important aspects that it can add some visual aids and interest to the training. If you're building your training as an e-module, which is also now known as an online training, it will be very important to put together a storyboard document that includes the visuals, the narrations, the specific descriptions of the engaging activities. These will be helpful because it provides the training development team or whoever is going to implement your e-module with the sufficient details and the instructions to build the module effectively. We have included in this slide a screenshot of the DMAS Civil Rights Refresher Training Storyboard, which contains the content that we have developed for this particular training. All right, so the implementation phase here is where the action starts, and this is where we will be delivering our training. During the implementation phase, it is very important that you conduct a conductive training environment that encourages active participation and engagement. Whether the training is conducted in person or virtually is very essential or is very necessary to ensure that participants have all the necessary materials and technology, and that the setting is comfortable and free from distractions. For example, if you are delivering your training in a classroom setting, making sure that the classroom is set up in a way that encourages interaction among participants might be important. If you are delivering your training online, testing the online platform and making sure that everyone can access the online platform will be very important. And to keep everyone engaged, again, using interactive learning methods, such as, for example, role plays or case studies or group discussions, those would make your training more efficient and effective. Regular assessments or quizzes should be also conducted to evaluate participants' understanding and knowledge while you are facilitating the training. And immediate feedback and clarification from the trainer should be provided during the training. It is important to create an open and welcoming atmosphere when or where participants feel comfortable asking questions and seeking clarification. That is always very helpful, so that if participants have any questions, they feel comfortable about asking questions so they can learn better. And finally, it's very important to manage time effectively during training sessions and keep the training on schedule. This ensures that all planned content is covered and that participants get the most out of the training. So after the training has been delivered, we are now phased on to the post-implementation phase. And this phase is very important because it's usually the phase where you can track who has completed the training. You can also provide ongoing education and updates and gather feedback from participants and integrate civil rights training into onboarding processes and assess or evaluate the program's effectiveness. You would run into these actions during this post-implementation phase. It is important to maintain accurate and up-to-date records of who has completed the training, and a secure database or perhaps a tracking system should be used to record this information. Plan also on sending out regular reminders for those that have not completed the training. That will be something very important to implement during this post-implementation phase. As we all know, we all stay very busy. We get reminders about trainings, but sometimes people has challenges completing them. So it's important to keep going and keep reminding individuals if they have not completed the training. It is also important to ensure that participants have completed the training and that they acknowledged it. This documentation is necessary for compliance and accountability purposes. If you're using a platform that automatically tracks or records the training completion, that is excellent. But if you run into situations where you don't have access to an automated way of tracking the training, perhaps you could just use an acknowledgement or some documentation that individuals can sign where they would prove that they have completed the training. So we have reached to the end of this presentation. We hope that this information has been helpful to those that not only have implemented trainings or those that want to implement a civil rights training for their organizations. We hope that sharing some of our information and tips on how we have done it at our agency can help and encourage you to develop a civil rights training in your organization. Basically, we have discussed how important civil rights training are for organizations, and with the details of the different phases, we hope that you have now good tools or that this is a very good starting point for you or your organization to implement civil rights training. All right, as I mentioned before, if there are any questions, feel free to enter those in the chat and we will address those at the end of the presentation. But now I'm very excited for the session of the panel discussion. I think we're gonna have a very good conversation with the 4 agencies that we have invited today to this panel discussion. We will be asking these 4 organizations a few questions, and we are just very excited to learn how they have or what are their plans on implementing civil rights trainings for their organizations. We have here today the Office of New Americans, Virginia DSS. Representing the office, we have Seyum Berhe, the State Refugee Coordinator. We also have the Office of the County Administrator, Public Affairs and Communications for Loudoun County, Sahar Bebutfar. She is the Accessibility Services Manager. We also have today in our panel discussion the Virginia Department of Health with Cameron Moore, the Language Access Coordinator. And lastly, we have the Virginia Employment Commission with Maria Lorna Battles, who is the Language Access Coordinator. Just to give you a little bit of background on how we will run this section. As I said, we have like 5-6 questions that we will be asking our panelists, and each of them will be responding according to what they have experienced with their organization, and I will just be moderating the discussion. So our goal is to have a very casual conversation where we can all learn from each other. All right, so without further ado, before I move on to the questions, let me have each of the panelists introduce themselves very quickly and provide us a little bit of background on their organizations. We can start with the Office of New Americans with Seyum. Seyum, if you would like to introduce yourself.
Sure. Can you hear me?
Yes, we can.
Okay, wonderful. Because you never know what technology does. My name is Siyum Berhe. Thanks for the introduction. I have been the state coordinator for the past 7 years. Before that, I was director of resettlement agency in Northern Virginia for 15 years. And before that, I was in the academia. So I do want to mention one thing. For 12 years, I was also interpreter trainer. So this is it was privilege, and I absolutely understand what everyone is talking about. So let me stop right there.
Thank you. Can't wait to hear more about that. So let's have Sahar. Sahar, would you mind introducing yourself?
Thanks, Masrat, for the introduction. Good morning, everyone. I'm Sahar Behboudifar. I'm the Accessibility Services Manager with Loudoun County. Loudoun County is located just outside of the Washington, D.C. in Northern Virginia. We have almost 500,000 population and almost 5,000 full-time and part-time employees. I also serve as the Americans with Disabilities Act coordinator for Title II agency. So my position covers both language access and disability-related services.
Excellent. Thank you, Sahar, for being here today. Cameron, would you like to be next?
Sure. Good morning, everyone. My name is Cameron Moore. I have the privilege of serving the Department of Health as the Language Access Coordinator. I've been with the Health Department for a little bit over 2 years, one in regards to the local health district, that being in Charlottesville, Virginia, the Blue Ridge Health District. And now I have the great opportunity of working at the central office level, developing a language access plan. And that just simply means that we're creating a central plan to be able to help the entire agency. So happy to be here, happy to learn, and thankful for the opportunity.
Thank you. I appreciate you being here. And lastly, from the Virginia Employment Commission, we have Maria Lorna. Please, if you would like to introduce yourself.
Yes, of course. Good morning, everyone, and thank you, Montserrat, for inviting us over to be part of the panel. Again, my name is Lorna Battles, and I am an Equal Opportunity Federal Monitor for the Virginia Employment Commission. I also serve as the Language Access Coordinator. Our main focus is obviously making sure that we do provide equal access to our clients and customers, regardless whether they have a disability or they have limited English proficiency. I have been with the agency going on for 3 years, and just grateful to be here and hopefully learn a couple of other things, a lot of resources. Thank you.
Excellent. Thank you very much. This is very exciting to learn how all these agencies, they have language access coordinator or civil rights coordinator that they are working on these efforts. This is a very interesting to see. So thank you all today. I will be asking the very first question. This one, I want to make sure that we are all following the time, but I understand that this one is very loaded and there's very good information that each of you can share about this one. So if you want to spend more than the 3 minutes, that's perfectly fine, because I think we can get a lot of information. So what are the current training practices implemented by your organization to address language and disability access for your staff? And if we have, let's have Maria Lorna start with this one, and we will continue with the rest of the panelists.
Sure. We do have several training practices that the agency currently implement, but I think I want to focus on the most, probably my favorite one. A couple of favorites of mine. We actually host an annual virtual equal opportunity training. We bring in a civil rights expert to actually give a presentation on compliance with Section 188. As you all know, we work very closely with Workforce Services. So WAIOA Title I, we primarily work with a lot of those customers. So we want to make sure that we definitely cover that basis, and again, in compliance with Section 188. So we're trained on civil rights law that apply to the agency's programs and activities. We ensure that we use the correct taglines, making sure that auxiliary services are available for those who actually need it, that we are an equal opportunity employer, of course. We talk about how to handle discrimination complaints from internal staff and actually external customers. So we definitely focus on that. We definitely talk about serving persons with disabilities, the tools and resources that are available within the agency and outside of the agency, how we work with, like you had mentioned earlier, stakeholders and partner agencies such as DARS, and of course, serving people with limited English proficiency and handling religious-based accommodations, because that seems to be an up-and-coming topic right now. So we definitely focus on that. We make sure that it's actually a mandatory training, specifically at this point for managers and supervisors, and we make sure that they make their staff take the training afterwards, because we can't all be on the training at the same time. So aside from that, with Patricia's presentation earlier, of course, with using qualified interpreters, we also take time to actually invite our vendors. We currently use a language line for interpretation services for our external customers. So we actually bring in our vendor to do a presentation to our staff to make sure how to work with interpreters and actually how to have that accurate, most accurate interpretation that we can provide to our customers. So those are two of my favorite things that I think it's very relevant to our conversation today.
Thank you. I think that it's very interesting that you bring the vendor to your agency to provide that training. I think that's probably very appreciated by everyone, and it's probably very effective. That's an excellent idea. I like that. All right, let's move on to Sahar. Sahar, what are the current training practices that are being implemented at your agency?
Well, we have available accessibility training that covers two topics, both language access and the ADA for all new employees during onboarding. So it's a brief training on these two topics, but the reality is that especially during onboarding, all new employees receive a lot of information. And one thing that we thought about is to provide same training on intranet, which is the internal website, that whenever they have any question, then they can go to those as the reference. And also, all information regarding our vendors, all contractors, related to language access, whether it's over the phone, whether for face-to-face and virtual, and also any disability-related contracts that we have for American Sign Language, whether it's scheduled or on demand for VRI, Video Remote Interpreting Services, and also closed captioning. They're all available on intranet, which is the internal website again. And no matter if I'm available to provide all those information, all the staff at any point of time, whether during weekend for sheriff's office or fire and rescue or social services, for on-call supervisors, they all have access to those vendors, their information, and about the procedure, how to schedule any interpreters. Besides all of them, I totally agree with Ma that she mentioned about how to work effectively with vendors. I work with them. We created a one-pager like cheat sheet for staff on working effectively with an interpreter, and they all have it at their desk, and also it's again available on intranet. And the last item that I have, I'm a certified ADA trainer, and I offer training to different departments, and based on their needs, they request for training. So in fiscal year 23, I conducted ADA-related training to 670 employees. And there were different topics based on the needs of that department, whether it was communicating with individuals who are deaf or hard of hearing, or just the overview of ADA for Title II agencies.
Excellent. Wow, lots of good work you are doing at your agency. In particular, I love the idea because we also have a SharePoint site where we share content of training or any materials needed for language access, and it makes it so easy when we have somebody at the agency asking, how do I have access to phone interpreting services? Well, I just share the link to that particular page and it's so effective. So I agree. But yeah, thank you for providing us an overview of all the trainings that you have worked at your agency. We have now Cameron, if you would like to go next and share your information, that would be great.
Sure. So right now, VDH is in the process of finalizing our language and disability access plan, and we hope that to be kind of the catalyst and the birthplace for a lot of the training. That's also in addition to us working on hiring a language access coordinator as an FTE or full-time classified employment or classified employee, excuse me. And this person is going to work in collaboration with the accessibility program manager to develop and implement new training programs that we hope to be able to have. Of course, our goal is to be able to have language access training that would be designed for our staff who are going to have direct contact with NEP and LEP individuals or communities, and then also cultural competency. We think that would be vital to add along in regards to the language access training, because without having that cultural competency piece, it would kind of be, it wouldn't necessarily be full to deliver that training and not have the other one on the back end of it. And so that's kind of where VDH is right now. We've done a lot of good work, offered a lot of trainings, but we know that there's a need and a desire to be able to offer a little bit of more expansive opportunities for training.
Excellent. Thank you for sharing your information. And lastly, with this question, we would like to hear from Si Yoon, if you would like to go next.
Sure. Thank you. I want to start with something Patricia said. Don't be scared. The English language is not in trouble, because it's not. As we all know, by the third generation, that issue is taken care of. So I have been telling everybody not to be nervous that we're developing this community, a society that cannot communicate because we have so many languages. That's a fallacy, and I just want to make sure that's understood. I know I am talking to the choir here, but so I am not, the Office of New Americans is not a direct service provider. I'll say two things. One, on a larger level, DSS is working exactly what my colleague from Department of Health just said. We are trying to develop, they're working on developing a stronger language access and disability access, and they will be hiring a person to run that. So that is that from DSS. But Office of New Americans, we were asked by General Assembly for the past 2 years to include immigrants in the services or contracts we manage. So my office is responsible for refugees, which has been forever. But now for the past 3 years, we also have immigrants in Virginia. So with that, I just want to mention 5 of the 9 people in my office are bilingual. The 2 people that I hired to provide services to immigrants, mostly information and education and connecting and informing of available services, are both fluent in Spanish and English. So that's the first thing from my office. The contract I have with refugee offices, having been a trainer in language interpretation, it's in their document to have cultural and linguistic capacity to just start with. Title VI, when I was a director, have worked on it. So what we do is we either provide staff members who speak that specific language, which is many of the staff are, and if they don't, they must hire. And hire not a child or untrained language speaker, but trained interpreter. So we have a very strong standard on that. The refugee side, with the majority of refugees these days, Afghans, they have very well trained some interpreters, but we conduct training here as well. But with other communities, our challenge has been with the smaller communities who do not have trained interpreters is the biggest challenge. I am not for telephone interpretation, and I'm against children interpreting, of course. But sometimes, as a last resort, I know it happens like that in the local Department of Social Services, but we try not to use that because we do have, I do want to mention the last one in honor of my colleague, my friend, my coworker who passed away a few days ago. We have developed mental health interpretation. As many of you know, Dr. Eva Stitt has done a phenomenal job. So we went further than just language interpretation. We have developed a manual for mental health interpretation because cultural and linguistic competency go hand in hand. Just because you have language, it doesn't quite work very well. So I just want to stress that in respecting her and the work she have done. Thank you, Montserrat, for giving me a chance to touch on this.
Yes, thank you. And we're very sorry to hear about the passing of Dr. Eva. She has done amazing work in Virginia for language access, and we're very sorry for that loss.
Thank you.
All right, so I think we can move on now to question number 2, and this one relates to technology. I think throughout the presentation today, we have touched so many times about technology and how relevant it is for training. So the question here is, how does your organization use technology to enhance language and disability access training for your employees? And we can run the same circle if Maria Lorna wants to start sharing her information, please.
Yes, so currently in terms of technology, we are still using more traditional platforms in terms of, the training programs that we currently roll out. However, what's exciting at this point is we actually recently added a training and development coordinator for the agency, and he will be overseeing the process of building more training opportunities, hopefully using an LMS, so a learning management system. So right now, for most of the trainings that we use, we still do it on a virtual platform. So MS Teams, Zoom, obviously WebEx, those are the 3 top platforms that we currently use. Virtual, we are starting to put together more in-person trainings, but we're not quite there yet, pre-COVID status. So that's kind of like where we stand at this point. But hopefully with Chris, as he's getting his hands and feet wet, and knowing the opportunities for training within the agency, hopefully we can see, a more robust structure going on in 2024.
Excellent. Thank you. Thanks for sharing the information. Sahar, how about your agency? How do you handle training and technology?
Well, actually, we have our HR department, Human Resources Department, went through the RFP process, and we have our own platform at this time. And we call it Loudon eLearns. It's a very user-friendly platform that we have to take all of our mandatory training on that platform. Besides that, if I'm going to offer any ADA training for any departments, we are using Teams. It's easier for me because then I can, have the, polls and, do the quick quiz and all this stuff on, Teams. And also we use WebEx webinar. That's something that if we offer any training to the staff and also the public, we use WebEx training. And the example is every April, we offer, April is the Fair Housing Month, and every April we offer fair housing for people with disabilities. And that's the training that is open to the public. And so that's something that we always offer through WebEx webinar.
Excellent. Thank you. How about Cameron with the Virginia Department of Health? Let us know a little bit more about how you use technology on your trainings.
Sure. So the Department of Health has a platform that is known as Train, TRAIN. As soon as someone is hired with the Department of Health, whether they are a full-time employee or a contractor, this online database or platform is how they are able to access their trainings. And so essentially it allows for various types of trainings as well, webinars, online modules. There's also the opportunity for you to be able to use that platform to register for an in-person training. So there's just a bunch of different resources that people can use in order to do that. And the hope is that to be able to use that already existing platform to add additional trainings to them as time goes on, specifically as it relates to language access. But right now, the Department of Health leans on Train for those folks who get hired in their first 90 days in order to do that. And they're able to use their work-issued laptops and devices to be able to complete those trainings.
Excellent. It sounds like you guys go with the automatic type of technology that automatically keeps track of training completions, which is excellent because it makes life much easier for everyone. So would you like to share some information about some technology that your agency might be using?
Just a little bit. If there was anything that COVID did anything good for us, was it forced us to think outside of the box. Because we could not provide services face-to-face for such a long time, different agencies, and we have around 10 sites in Virginia that provide services to refugees. so everyone does their own thing on this, but we funded computer technology. We even funded some refugees to have, those who don't have telephones, to provide telephones so they could conduct even employment training, language interpretation. Everything was online. And guess what? We actually achieved our outcome goals, nothing less than when we were doing it face to face. Here we go. So I don't have every name of the platform they're using, but we use technology extremely well because we were forced to do it. And now we're becoming, well, this is not so bad, maybe. So I worked from home for the past 3 years. I think we're working, but I cannot give you any specific technological aspect we're doing, except the refugees are probably ahead of us when it comes to the phone system. So they learn real fast and they're doing very well on that. That's all I can share with you.
Thank you. I think it's noticeable, the trend that we are all going with technology. Everyone has explained how they're using technology, but I want to reinforce that sometimes in-person trainings are very helpful, and we have recently completed very simple training with some DMAS staff that have more interaction with members, and they didn't know how to use phone interpreting services. So we decided to put together a classroom. Hard to believe in after COVID days that we can meet in person now, but we put together a team of 10 people in a classroom. We call our phone interpreting services vendor on the spot, and we just walk through the process on how to engage with phone interpreting services and how to have the person on line while the interpreter interprets. So with that being said, I believe technology is taking us very far and making our life much easier, but sometimes adding the personal touch and doing face-to-face training, I think it can be very beneficial as well. So just wanted to add that piece of information. But I am curious now, as far as to learn a little bit more, what are the key components that you include in your trainings about civil rights? I'll be curious to learn a little bit more about what topics you touch on your training. So if Maria Lorna, you wanna go first?
So part of my role is actually to go out on the field and as a federal monitor to assess the knowledge and the tools and resources that is available to our staff members. So, because for us, we provide you with what you need. So that's kind of like where we're coming in. With what you have right now, what else can we help you with? What programs or what webinars or what trainings we can actually put together to help you, again, provide equal access and opportunities to our customers. So for example, just a couple of weeks ago, I was in Northern Virginia. So Northern Virginia setup is so much different than Central Virginia. Diversity is obviously very, very obvious, prevalent in that region. So I was able to get a lot of feedback from staff members just in, within Northern Virginia with like 5 different counties. That's almost like a completely different country out there. So for us, making that assessment, like it's a different region out there. How do we actually strategize in as much as, the resources they have is probably more than in other places like Central Virginia or like Southwest Virginia comparatively. So for us, assessment is key. And then we move forward from there. Like, I receive information from staff like, oh, we didn't know that, the TTY machine is obviously obsolete nowadays. But how many people know that within your iPhone, within the accessibility tab, you can actually activate a TTY RTT feature. So available resources like that we would not know if we don't go out and visit and make those assessments and hear what our staff are experiencing, you know, on a first-hand basis. Thank you.
Yeah, thank you for sharing that information. I do agree that learning from our staff about what they need to learn, it's very important. So including that as part of the training content, it's great. Thank you for sharing that. Sahar, would you like to go next?
Absolutely. Thank you, Malarna, that you mentioned about diversity in Northern Virginia. Just to give you the idea about Loudoun, based on the fall enrollment for Loudoun County Public School, 107 languages are spoken in the house in Loudoun County. And so the important components of LEP training, limited English proficiency training, for me is to provide demographic of our population to our staff and bring awareness. And every year I update our annual limited English proficiency plan. It is available on our website. And basically it starts with Title VI of Civil Rights, and then our policies that we have, not to discriminate people that they cannot speak English very well, and then demographic of our community, and then top languages that are spoken. And then after that, I provide information about the usage, language usage of our departments, and provide information about the resources that we have in Loudoun County. And at the end, I'll usually wrap up with the outreach in different languages from different departments. So this is the plan that we have, and mainly it also used for training for LEP because it brings awareness and the needs of our community. And it's also available on the website. So all of this information as a transparency are available for the public. And just a quick data, in fiscal year 23, we used 144,000 minutes for over the phone interpreting services for our departments. And regarding ADA training, since I created all of the training for our staff, the main focus regarding materials is on ADA requirements under Title II agencies, the requirements for state and local government agencies, and disability awareness and general disability etiquette guideline, what to do, what not to do. And the important part is our available resources in Loudoun County. So, but I always consider like what is more important for this department. For example, the training for ADA and law enforcement or overview of ADA for a correction system is definitely different from customer service folks. So considering the needs of that department, I provide different types of training for our staff.
Interesting. Yeah, and I had a chance yesterday to review your language and disability access plan, and it's excellent. If anyone that is attending wants to take a look to their website, it has very good information, very good data to understand your community needs and how much effort your organization is putting into language access. So very excellent piece of information. Thanks for sharing that. Thanks for sharing the link. All right, so Cameron, would you like to share a little bit more about your plans or what you're thinking about including in your trainings as far as content?
Sorry about that. I was struggling to unmute. In regards to what we hope to be able to add, like I stated earlier, we want to be able to partner with our accessibility program manager in regards to being able to make sure that our training is comprehensive. So that means in regards to things like translation services, we want to be able to have trainings for that in multiple languages to accommodate employees and individuals, even employees that we may have that are NEP or LEP, trainings on closed captioning in regards to the same thing I just listed for employees who are deaf or hard of hearing. And then the biggest piece is I think that I can speak to is in regards to providing training on ADA compliance. In the construction of the Language and Disability Access Plan, we really have learned about some of our blind spots as it relates to ADA compliance, and in regards to how the LDAP needs to be a little bit more comprehensive. And so those are some of the things that we want to make sure that in regards to curriculum is widely distributed for those who are in the agency. And I think oftentimes as it relates to language access, those who are deaf and hard of hearing and those who may not be able to see is something that's kind of not necessarily thought about in relation to language access, even though it's an extremely vital and key part of that. And so we want to make sure that when we are disseminating or distributing the Language and Disability Access Plan, that we make sure that we hone in on that for contractors and full-time employees, so that we're not missing a major part of the constituent for the Commonwealth that need those services as well. So we want to be able to, again, just kind of focus on the, you spoke to it earlier, the train platform. We'll be able to see who is taking the trainings, who's completed them in a timely fashion, and making sure that we're able to reach out to the people who have not taken the steps to take those trainings, so we can make sure that we do that. And we also want to make sure that we're working with community organizations as well to make sure that our training curriculum is well thought out and well developed.
Excellent. Thank you very much. Sayun, would you like to share some information as far as what concepts or knowledge you would be sharing on training pieces, or what will be important for your agency to share?
Absolutely, thank you. I think the first thing is Title VI, because refugees all come from different countries. The second, also very important one, is faith, religion. It doesn't matter what religion you follow. It's fundamentally the rights in the United States, which is really shocking for a lot of newcomers, because we're immediately telling them, after we have told them their responsibilities, but we're talking to them about their rights, no matter what religion you follow, no matter what country you come from. These are your rights, and this country respects that. And that's a very positive foundation for what we do. We have documents are always, all the agencies try to get the document explanation in the language of the separate different countries and communities. So they do very well. We have also hired people who work with our school system. Every agency have what we call school liaison. That's the person building bridges between the school, parents, and children, linguistically and culturally. We also have what we call health liaison. Our health system is difficult for us, let alone for a newcomer. So we have health liaisons who are also navigating the culture, the linguistic aspect, and the complexity of our health system. So one area that we were not very good at was the disability area, because we didn't see a lot of refugees coming. Now we do. So we have to learn real fast. We have, but that was really our weakest, because we didn't have to deal with it. Now we do. We have started to work with specialists on that and talking to our state entities. And I have seen few disabled refugees who came are doing really phenomenal. But it took us a while to really grasp that and move with that. Thanks.
Excuse me just a minute. Montserrat, the sign
Yes.
language interpreters need the camera on.
Yes.
They're
We have,
asking in the chat. I'm sorry to interrupt.
yeah, no, I'm glad you're bringing it up, because trying to deal. Oh, here we go.
And
Perfect. I'm glad I'm glad it worked.
I want to add one more thing with this subject. Our second most difficult one was sign language. We try, but sign language, American Sign Language is not the same with all the countries. So I have to admit that has been the most difficult one to implement it, because we tried one time and we failed. It was just, we didn't even know why we failed. This is years ago. And I'm like, oh, so let's focus on that. But that's a difficult one. And a small communities who have nobody here, and there are some, by the way, that's the challenge. So we're dealing with that as much as we can.
Yes, I do agree. I mean, it is obvious that we are working with a very challenging environment, trying to accommodate everybody's needs for language access. It is a challenge, and I'm happy that we are all working together to try to find solutions and learn from each other, because it's not an easy program, and it proves that trying to learn from each other, we can get better. But I understand and I agree that it's a quite challenging environment. All right, so for our question number 4, I believe most of the topic or most of the information has been already shared. And this one in particular is trying to assess how your organization tailors training to meet the specific needs of different departments. Is there anyone that would like to volunteer from the panel to add some additional information that perhaps has not been previously shared?
So for VEC, since unemployment insurance is a completely different beast, you know, that they definitely conduct, you know, a more extensive training for that department, just in terms of benefits and claims and things like that. So all of our departments are pretty much given like an autonomy to make decisions as to, you know, how much more training can we actually give to or provide to our staff members depending on the business needs. So that's kind of where we're at right now. However, on that aspect, I do want to just gonna give a shout out. Some of you might know that the VEC workforce services and unemployment insurance is actually kind of not going separate ways. We're still going to be working together. However, there is a newly formed agency. It's the DWDA, which is the Department of Workforce Development and Advancement. That is actually, well, it's already official, and then it's going to be a new agency. So hopefully, I think my intent here is to, we will have opportunities, new opportunities to kind of like bake in some of the training opportunities that we have in terms of equal opportunity, since we are building this new agency. Our new director will be Carrie Roth, who was the former commissioner for the Virginia Employment Commission. So hopefully, you know, merging of resources and new resources coming in, we are going to hopefully build this agency and do more of the proactive work in terms of the equal opportunity piece of things, as opposed to like, okay, some of it might just be an afterthought. So so that's kind of the hope at this point, and definitely stay tuned, and I will probably be reaching out to some of you and get some more information. So thank you.
Excellent. Thank you for sharing that information. Sahar, is there anything you would like to add or share more about the particular tailoring the training to particular groups for your organization? I believe you spoke previously about work enforcement, but is there anything else you would like to add?
Well, just a quick things that here we centralize accessibility services. So which I think it's very helpful because I have access to all contracts for both language access and disability services. And one thing that we all need to understand is disability is intersectional with many other needs. So it's like it can be a person who is a refugee or immigrant with a disability, and they need both services. So it is very important for awareness regarding language access and disability awareness to all the staff, and make sure they have access to all resources to provide services accordingly. As Sayo mentioned, there are many folks that they are newcomers with a disability or disabilities, and also they cannot speak English very well. So I think just centralizing or work closely together, these two divisions, it is very crucial.
So were you gonna share something? I thought you wanted to share.
No, I think they all touched on the key issues. Working together, this is coming really good, as you mentioned, Montserrat, because if we are all working interconnecting, I think we can take care of this, even though we know it is challenges. So that's all I want to repeat. The working together, the relationship we need to develop. That's all I want to say.
Thank you. Cameron, is there anything you would like to add to this particular topic or question?
Sure. I think with the health department, one of the tricky things is that Virginia is such a geographically diverse state. There's small pockets in different places that have dominant languages spoken in different places. And so the hope will be is that once the central office language access plan is devised, the language and disability access plan is devised, that there will be some special attention to tailor specific needs and things for each local health district, just because their needs may vary. There's some local health districts who are farther along than others. Richmond, Northern Virginia, they've already started to do some really good work on language access, but then there's some other health departments that are just starting on this process. And so the goal is in regards to meeting these different, I guess we can call them departments, but specifically, how do we assist each local health district in providing quality language access for the folks that need it? And that's going to come with a lot of community collaboration. And so we're starting the process of devising a work group that's going to be extremely inclusive as it relates to all of the different facets of the health department. And we've reached out to leadership in regards to picking the folks that, they feel like need to be a part of that specific work group, because we recognize that language access is not a one size fits all, specifically as it relates to the entire state.
Yes, a very interesting approach, because we do also include in our language and disability access plan, we include the most frequently used languages in Virginia, but we realize that for our program, Medicaid, those might not be necessarily the same ones, particularly the top 5. Might be the same ones that we have as far as frequently used languages within the Virginia Medicaid program. So it is interesting how this has come out as a conversation, how each organization statewide might have some different languages from the local level. So how that, again, going back, might represent a challenge, but how it is very necessary to understand the particular needs for the population that you are serving, as they might be different from the entire state. So interesting conversation. Thank you. Thank you very much for sharing. And we just have one more question, and that we thought that it would be, I have, Marielana, I see that you raised your hand. Go ahead.
Yeah, since we had been mentioning and focusing, obviously our work on our individual language access plan, Cameron kind of touched base on this a little bit. I do see that there's another opportunity that's coming up, just because I know we've been mentioning about LEPs, limited English proficiency. However, data does show, especially in Northern Virginia, that there is a predominantly increased or uptake in non-English proficient individuals. I know that's on Washington DC's radar right now. You know, most of their language access programs address the NEPs and not just the LEP. So I just think that would be a trend that we need to actually monitor and, you know, prepare for.
Interesting. Thanks for sharing. Great. So again, I think we have touched a little bit on the topic of track, the training completion. Maria Lorna, is it something that you would like to share more in specific about how your agency tracks training completion for individuals that take the training?
Yeah, so we definitely still have an opportunity in terms of like the tracking aspect of things. I think most of the things that we track properly are what we considered mandatory. I think that is definitely an area of focus for our training and development coordinator down the road. Right now, the HR folks do track the completion of, you know, what we consider mandatory, but anything else is pretty much, you know, it's definitely resource purposes, reference purposes at this point. So, because there's so much bandwidth, I think the staff can have at a certain time. I think we need to keep that in mind as we obviously develop and implement those training programs. So
excellent. Yeah, that always represents a challenge. That's why I wanted to gather some feedback and some tips from you all. How about for you guys, Sahar? How are you able to track training completion?
So, well, if that's the mandatory training, then it's through Loudon eLearn, so it's very easy to track everyone's because they receive at the end they have to take the quiz and then they will receive a certificate, like internal certificate. And but for those that I offer and I do virtually, so I always can track the number of folks that they're on the call. And I always have a co-facilitator to monitor, the chat box and, the number of attendees, not including panelists or not panel, like the presenters that they are basically are there to help for advancing slides or like doing quiz or breakout rooms or something like that. And the other thing for in-person ones, I have the training evaluation form. So basically that's another facet to see, to track the number of folks that they are attending. And for, for most trainings, I'm very fortunate that, folks attend, because when it comes to, I think title is very important. For folks that they want to attend optional trainings, and for mandatory, then it's just the general like overview of ADA or like LEP. But for those that they're optional, I always try to be creative about title of the training to make sure like people feel like they need this information, for their awareness and especially for ADA. I always mention that it's not a matter of like just learning this, anything about ADA for work. It's a matter of your rights and also your loved ones, because no matter what, no one signed up to be a person with disabilities. Any of us can become a member of this community at any point of the time. So it is always good to know about rights and resources for ourselves, for our community, our loved ones. So I'm very fortunate that many staff, they're attending, they're very much involved. And so these are the ways that I can track.
Yeah, excellent. Yeah, Cameron, I think you shared before that the Train platform keeps good tracking of completion training. Is there anything else you would like to add?
Sure, and that is correct. The good thing about train is that not only can you see your completion and go back and revisit trainings that you may have had to pause for whatever reason, your supervisors are able to see that as well. And so there's kind of dual vision as it relates to the tracking platform to see what it is that you need to do. There's a litany of different things that are in that platform. And so the good part about it is that it really keys out what you specifically need to do for your role. When you get hired, some trainings are applicable to everybody, and then there's some trainings that are only applicable to you and your role. So the good thing about that is again, everyone can see, whether it's employee or supervisor, can see, what it is that needs to be done or completed in a timely fashion.
Yeah, thank you. Seyoon, is there anything you would like to add as far as tracking training completion?
Sure. The non-refugee immigrant side is very difficult because we do not have on the ground funding to conduct services. So that's a tough one. With the refugees, we got over 8,000 newcomers, new refugees to Virginia. Every one of them is in the system. Every training done for them or done for the staff is in the system. The reason I know the success story of the disabled person who is now working and paying his rent was because I have the data. We call it Virginia Newcomer Information System. So we have, it doesn't mean we capture everything, but we are really, well, I mean, it's federally funded. Obviously, as you know, we got to have the data. So we got it. But the immigrant side is where we have not gone that far mainly because of funding, to be honest with you. So we got it for refugees, but not for other immigrants.
Yeah, interesting. I'm glad you shared that because previously I was working in the Refugee Medical Assistance Program, and yeah, I was aware that how there is a tracking way for the training. So yeah, we always try to go into technology, but again, sometimes there's not enough funding to use technology, and technology keeps advancing as well. So we might be using some systems that then become obsolete, and then we need more funding. So yeah, I see the challenge. Well, this is the last question that we have for our panelists. I wanted to, before I close, I wanted to ask the panelists if there's anything else that they would like to share, or any information for the particular agency, or any information they have learned today that they thought it was important to highlight. And I see Sahar, she's raising her hand. Yeah, go ahead, Sahar.
Well, I just want to mention something. We are talking about technology and how it makes many things easier, but we need to be mindful about whether they are accessible or not. So when we move to any new platform, whether they are user-friendly, whether they are accessible for our employees, or if, for example, regarding the same case, whether the platform is accessible for immigrants and refugees. Most of the time, this is something that people overlook. And when I'm talking about accessibility from the disability standpoint, whether it is something that people can use it easily with using screen reader, whether it's good for folks that they are low vision, whether it's good for like any types of disabilities, and especially these days for like neurodiverse community, those individuals with autism, ADHD, and so on and so forth. So since there are many different agencies are on the call, I just wanted to mention this. Please be mindful about the process that you are selecting any platform. Please make sure you consider all aspects of accessibility. Thank you.
No, thank you very much for sharing this. This was one of the notes that I wanted to share on my presentation, the accessibility aspect of the training. I don't believe I spent much time to explain it, but we did find a situation at our agency where we developed this e-module or online training, which was very engaging, and we used the storyline platform that we understood was accessible to screen readers and things like that. But then someone at our agency reached out to us and mentioned that due to their visual impairment, they were not able to follow the instructions or even use the mouse. So we determined that it was an important aspect for us to develop an alternative training. The solution that we found was to complete a desktop recording of the training and just provide a video. We reached out to the person who had the challenge to access the training, and it worked very well for them, as they could just listen into the training and they didn't have to take any actions using their visuals or their mouse. So I'm thankful that you brought up this aspect, because it's very important that we talk about engaging and images and things like that, but we need to consider the accessibility aspect and limitations that some people may have. Thank you. All right. Is there anybody else in the panel discussion? We will next, we will open for questions. I will reach out to my colleague to see if we have any questions that the panelists can also address. But if there's any additional comments from the panelists, please feel free. We're doing very good on time. So if there's any additional remarks, feel free to share. You can raise your hand or speak directly. And if not, we can just continue and open the Q&A session. And again, my colleague Jesus has been collecting. I haven't been able to follow the chat, but Jesus, are there any particular questions that you think we could address at this time, either us or the panelists?
Hi, Montserrat. Yes, we have been receiving some questions during this session, directed to the panel. And the first question is from Steve Grammer. He wants to know if there is a way to be sure that people like case managers and service facilitator take tests to be sure that they are up to date with the regulations.
Jesus, do you mind repeating that question one more time?
Yes, Steve Grammer asked if there is a way to make sure that case managers and service facilitators take tests so they are up to date with regulations.
All right, so it is about case managers and service facilitators, and I don't know if that would be under any of the panelists. So what we can do, we will reach out to Steve. We might perhaps need a little bit more details on his particular question, and we will certainly address that at a later time, but it feels like we might need a little bit more details on what particular tests he's referencing. We'll reach out to Steve later. Are there any other questions, Jesus?
Lisette Uria asked for any insight on what can be done for interpreters who assist families in special education.
Maybe Patricia, is that something that perhaps you could address? Let me see if she's, I'm not sure she's still. Yes, you're logged in. Yeah, would you like to address that question, Patricia? I think you will be the best fit.
I'm sorry, for disability, can you repeat the question? I heard it, but I wasn't sure you were going to give it. I didn't know you were going to give it. So I'm not.
Put you on the spot, right?
Yes, sure. Lisette Uria asked for any insight on what can be done for interpreters who assist families in special education.
Well, actually, I think that there's a need for more training for interpreters that are working with families with disabilities. I think since there's so many different kind of disabilities, there's just a lot of terminology and a lot of vocabulary that I think that sometimes, are challenging or the interpreter doesn't know. And I think that without that more training, sometimes what the interpreters do is that they guess, or they, from the context, and sometimes they're just not getting it exactly right. And then, I mean, even in the IEP tests and things like this, it's difficult. It's not so easy. And there's a lot of, well, in legal terms, there's the legalese. I mean, and in education, and there's like this also terminology that it's very common to the people who are talking about this, even just what is an IEP? It's an individualized, right? Education test, so life, and plan for the education. So it's understanding all of these terms. And I think that the interpreters, maybe also talk to others that are working in that same field, and then talk to the different people in the state. I think we have a lot of resources around us that we don't even know we have. So other people who are working as interpreters in those type of, for those type of programs or agencies or whatever can get together. But I think by, getting in touch, with Montserrat or with me, I would be very happy to give you, some leads. I don't have that just at the tip of my hands right now, but I have spoken to many people who work, with families that have disabilities, and it's difficult. It's, I don't know if my colleagues have anything to add.
Looks like Sahar would like to add some information.
Well, just based on my experience, I'm the certified interpreter for Farsi, and so I'm, familiar with the, how to interpret accurately. At the same time, I'm familiar with Americans with Disabilities Act, so I would say something that needs to be considered for an interpreter who's going, to provide services to a special needs, kid and their family. It's good to know about, ADA requirements. All the, information is available on ada.gov, especially for Title II agencies, education, the higher eds, and also schools. They are also under Title II agencies. It is good for them at least to become familiar with the requirements under Title II, what to ask, what not to ask, how far they can ask about disability, or about the best practices about during interpreting. There are many good information on ada.gov. That's my 2 cents.
Excellent. Thank you. All right, I think we can move on to the next question. And we have one, Jesus.
Yes, we have a last question, very interesting, from Leah Coito. She's asking if there are trainings, accessibility trainings, for those that are in charge of website creation or website content.
Yes, Sahar, I think you have your raised hand. Go ahead.
Yes, I would say I saw that question and I thought it was a great question. So actually, there are new rules about website accessibility, and I think the new rules published, I think last week or maybe a week before that. And it's always good to provide some training for those individuals that they, update the website or they create any social media posts for any state and local government agencies. They need to be familiar with color contrast requirements, with font size, preferred fonts, and also alt text. It is very important to provide a training for staff that they are working on the website, proper heading, and these are all required for, there's a reason behind that. It's all because those individuals that they are using screen readers, if you don't follow the rules, then the screen reader starts reading scatterly. So make sure, there are tons of resources on intranet. If you Google it, you can find it through universities, through ada.gov, through different agencies. And I highly recommend to just find resources, at least for basics, for those individuals that they are working on the website or social media accounts.
Thank you.
Yeah, I posted the link. There's a digital.gov. That is actually a good resource for anything that is like website accessibility and ADA compliance. So there's like some web-based trainings in there that I think, people who manage this website can definitely look into.
Yeah. Thank you for the information. I wanted to take the opportunity with this question to share a resource that we have at our agency at DMAS. We have our digital accessibility officer, Lisa Dove, and she has implemented a large number of trainings in regards to digital accessibility. There is a lot of information out there online, but sometimes it is very complex to understand. So our colleague Lisa has been doing an amazing work to make that information more digestible for each of us, so that we can, when we put together, let's say brochures or flyers or content for a program, that we take into consideration the main aspects of digital accessibility when that information is being posted online. So I wanted to say this because it might be very complex sometimes to understand all the information, but it's very important that at least everyone is conscious of the digital accessibility aspect and try to learn as much and make their content as accessible as possible. Luckily, we have someone here at agency that does a great job training all of us about that. All right. Jesus, did you mention that that was perhaps one of the last questions you saw, or is there any other question out there?
No, we don't have more questions.
Okay. Well, if anyone can think of any additional questions, you can send those to us at the email right here, the Civil Rights Coordinator. We will be happy to address any questions that relate to today's topic. And let me just go through the last slide. I just wanted to put together some resources that everyone can use to learn a little bit more about civil rights training. And also, as mentioned earlier, we're sharing Patricia's contact information here if anyone is more specifically interested in reaching out to her about interpretation and translation accuracy. And that's it for all. I just wanted to say thank you, everyone. A very special thank you for all the panelists for sharing their resources. I think this has been an extremely informative session, and I hope that everyone has learned something new today. And I hope that we can use this session as inspirational for all of us to continue the great work that we're doing about language and disability access, and to take into consideration that there are barriers for individuals with limited English proficiency and individuals with disabilities that we want to make sure that we address so that they can access our services and that we can communicate effectively with all of them. So if there are no further comments or questions, we will close this session. Thank you very much. Thank you to Jesus and my team for all the help, and we'll be in touch soon for the next forum. We will plan a few additional forums for 2024, so be on the lookout on our website where you will be seeing the next upcoming dates. Thank you, everyone. I appreciate your time being here today.
Thank you all.
Thank you. Bye-bye.